and in cost. 4 months ago, when Obamacare opened for business, the Administration had to that date refused to release complete enrollment data or how we were going to get it. Today, we still do not know how much it has cost, how many people have signed up, what coverage is there, because it is, in fact, one of the most opaque government programs to date. What little enrollment data we have is, in fact, not good news. For the numbers to balance, the Administration officials originally claimed that 39% of enrollees needed to be young adults. As of January, only 24% of enrollees were young adults, and many of those young adults may be highly subsidized. Affordable care depends on a healthy young people buying a plan to subsidize the cost of the aged and the sick. It needs enrollment to balance. It isn't something you can force. It is something that must be chosen. In just the last few days, the Administration announced hundreds of millions of dollars will be spent trying to advertise for and recruit those people to sign up for a program that we were told people would flock to because it was good and they needed it. The fact is, the Affordable Care Act is not working, and the numbers are not working. Just yesterday, the Congressional Budget Office released figures that showed dramatic adverse effect on total enrollment and a cost of $2 trillion over the next decade, a $1 trillion difference in their estimates. The fact is, the Act is not performing. CBO is now being forced to recognize, not as the White House would say, that we would, excuse me, not what the White House would say, that people are choosing not to work as much and they have flexibility, but in fact, people who want full-time jobs are finding themselves with less than full-time jobs and often without health care. Additionally, the GDP of this country, the engine that creates jobs, is likely to slow by as much as 1% over the next decade. That is a long-term bad news for our economy. This does not mean that the goals of the Affordable Care Act are, in fact, to be given up. This committee and all committees of the Congress have an opportunity to seize better choices in how we fashion health care opportunities for the American people. Health care insurance companies make money off of the Affordable Care Act, and the profit is theirs to keep. In fact, although they are not villains, they certainly were an organization, many organizations that were previously vilified in a big way until it became convenient to get them on board with the Affordable Care Act. Affordable Care Act guarantees subsidies and higher enrollment for the health care companies. Today, we will take a number of items, including our first witness, who will speak to one of the flaws in the system, which is, in fact, a guarantee of profit for the health care providers, one that may cause them to price their product in a way that is not in the best interest of competition. This program is called reinsurance. A key question we will ask today is what will trigger the bailout provisions and how will it take effect? Under the Obamacare's risk corridor program, if an insurance company cannot cover the losses of its less successful plans, the Treasury will use taxpayer funds to cover up 80% of the loss. Yesterday, the Congressional Budget Office estimated Obamacare's risk corridor would give government a gain of $8 billion in profits. It is important to note that that is based on another program in which every year the American people have found themselves overpriced relative to a shrinking cost of prescription drugs. It is not necessarily a valid model. It certainly has one critical difference, which is Medicare Part D was a program which, by definition, was new and did not have a large pool of history. In the case of the Affordable Care Act, most of the carriers are providing exactly the same type of insurance to the exact same pools as they always have. CBO's projections also concluded that the Affordable Care Act will cost the economy 2.5 million job equivalents. The agency report found the negative impact effects of the law would be substantially larger than had been believed. When they say substantially larger, let's understand, according to the then Speaker, Nancy Pelosi, the Affordable Care Act was going to create 4 million jobs. It is now going to cost us 2.5 million jobs. CBO is a respected nonpartisan agency on which the ranking member, Mr. Cummings, and I rely daily. But even CBO can only make projections based on information available on hand, and in fact, the Affordable Care Act continues to migrate. It is well known that at the time the Affordable Care Act was being projected, CBO was much more optimistic as to what would occur. In 2011, CBO estimated, as the law was being implemented, that it could cost 800,000 full-time job equivalents. Again, today they now estimate 2.5. CBO's revised estimate is based on a better understanding of the law. Remember, this is a law that we had to pass before we could find out what was in it. More importantly, out of the 2,400 pages of the original law, we have now mushroomed into over 70,000 pages of regulations, and they're still being made. The law's reinsurance program levels a fee on health insurance consumers to subsidize plans in the exchange, meaning people who already had a plan that they wanted to keep, that they may or may not be able to keep, are being taxed as part of the Affordable Care Act. Most, if not all, Americans were unaware that they would be taxed for a program, even if they had a program they liked, meaning that the programs they're in cost more because of an Obamacare tax. The noble aspirations aren't enough to make Obamacare cost-effective or fair, and it's driving up the cost of insurance and driving up the cost of providing health care. Its implementation has been marked by arbitrary and unilateral delays made by the White House, many of them beyond any fair interpretation of the four squares of the law. In closing, I think my colleagues are aware that no one on my side of the aisle voted for the Affordable Care Act. We did not believe in element after element after element of it, even though we would like to have done a few of the elements of this law. Therefore, we are not neutral observers, but CBO is a neutral observer. And I believe that the testimony that's going to be given today by our distinguished Senator from Florida, Senator Rubio, who has proposed a bill to repeal the risk corridors in the President's health care law, comes both with a timely proposal and with a recognition that after you guarantee